applies here onwards is going to be a description pattern for each of them. And four common points you have to touch upon once you get something in your hand or you pick up something. Number one, what it is. You have to identify it correctly. Then you will also have to describe in terms of their characteristic, why that is so, what made you think that, and that will be used for the usage also when you are going to describe that. What are the typical characteristics, whether that is a ratchet instrument, box instrument, the hinge and fulcrum instrument, or just a recoil instrument. Then how do you handle that? Examiner will be asking you, can you show me how do you hold in your hand? And you'll have to show that. And then comes the uses, where you have seen the user, what else can be, where else can be it will be used, and why that particular use has been designed, how the instrument design helps in that particular use. So these are the broad points where you have to touch upon. Let's come to the first one, what it is. So when you answer that question, you have to say the complete name. Try to be as complete as possible rather than say this is Finocchiato. No, that's not the way. It's supposed to be Finocchiato double blade chest wall retractor. Then there is no scope for further question in terms of what it is. Then the type of instrument, what kind of instrument it is. So again, the answer should be it's a forceps. No, clearly say right angle artery forceps or clamp. Then it comes, sometimes there are examiners who are very particular about the historical aspect of instrument. Deaver's retractor. So how do you spell Deaver? You will be asked. So these are some of the points, but don't think that they will be penalizing you for that. But then if you know that, that shows that you have a depth of knowledge about any given instrument. Not only that, the how it is used, but some left and right of the historical aspect that is also desirable and that is going to help you as well. It's a I've seen some of the exams, then examiners, they are very fond of asking what is the spelling of that particular name or so. Yes, that is something, if you can tell that clearly, that impresses them and you should be ready for that. Then comes the characteristic. Because every design has a reason why that particular design has been made. There should be logic behind that. And what are the uses of that? Again, that will be explained in terms of that design. If there is a limitation, that also will be explained in terms of design. So major part of the instruments are either it will be handle, shaft, jaws, tips, and then joints. So these are the 5 points that will cover how the design has been thought about regarding the use of that particular instrument. Similarly, the shape and structural detail, that is a ring handle or it's a just pincer grasp instrument. So these are some of the things you have to tell. Also, there may be some variation. If right angle artery clamp also, then you can have some variation in that. If you know that, it's always better. The size is one variation, but also the shape, which is helping, like the tip may be different, the scissor different angles may be there. So these are the variation you should be knowing about. Then comes the correct way of holding the instrument, because certainly you will be asked to show that how do you hold the instrument, and you should be ready to show it by correctly holding it. If you are awkward in that, it's not a good idea in terms of presentation. So there is a particular way of holding an instrument to help you ergonomically. So your hands are pretty comfortable holding that instrument, and the angle of approach, how you, particularly in deep surgery, say for example, if you are given a Satinsky, then you should not be facing it tip towards your side. The curve is there, it should be forward, and tip should be upward and away from you rather than towards the, because it may be a different use, but then what is the common pattern of holding that? You should be having that. And also, how do you support the instrument in your palms or your fingers or in your hand? Then comes the, what are the uses of the in particular instrument? So there are two ways to answer that. One is the primary surgical purpose, and that you have to describe. If it's a hemostat, the answer is to catch a bleeding vessel. Perfect. Dissection of the tissue plane, because that is also another use of that. Also, there will be some retraction. For that matter, if you are having Ellis or Babcock or so, although the reason why it is used is grasping that, but then part of that is also true for little bit of retraction for that instrument. Similarly, forceps. So it is used for dissection, it's used for suturing. So you can say that these are the primary uses, but it can also be used in XYZ manner also, whatever you know of. This is the precise technical point or step where it is used, but then you will be slowly transitioning to the point where now you'll be approaching the description of the surgical procedure, and that's where the transition happens. So they will be also asking you which surgical procedures you have seen being used it. So you'll have to name that, and there comes the further discussion. Now comes to the what are the variation of the given particular instrument. It can be either straight or it can be curved. Simple seizure, Mayo's seizure. It can be curved, it can be straight. Then you'll have to answer that why, in what situation the curved is preferred and what situation straight is preferred. Similarly, tooth versus non-tooth forceps. Locking instrument versus without lock. Again, there are a couple of advantages, couple of disadvantages, and you should be aware about that. So these are some of the variation I'm just trying to bring your attention to. Serrated versus plain jaws of the forceps. Traumatic versus atraumatic. This is a favorite point of question again. And also, there are some instruments where the joint is boxed versus without box. So you should be knowing what are the advantages of a boxed instrument and what are the disadvantages without that. Now, as I said earlier, that it's not feasible to cover each and every instrument in short session or so, but then we will be covering some broad categories. Essentially, all the description what I have said so far applies to them, and the pattern of description will be also more or less similar. So the common categories which will be placed in front of you is dissecting forceps, tissue holding forceps, hemostat, seizures, needle holders, retractors, either it will be handheld or maybe self-return, because these are the some of the fundamental instruments which are being used in almost each and every surgery. And there will be some organ-based instruments, like there will be some thoracic instrument, some thyroid instruments, some gynecological instruments. So organ-based or particular surgery-based instruments will be there. And then there will be a category of some energy devices, tubes and drains, which I'll be covering later on. Now let's just take up one category at a time. And first I will be taking up dissecting forceps, which is very, very common. Almost every surgery will be using that. And how do you describe that? Again, in terms of the function, the idea is to hold the skin, fascia, bowel wall. It depends which one you are using. That it will be plain forceps or it will be tooth forceps or any tissue edge which while dissecting to provide a support or the counter traction. So again, the characteristic is that there are two limbs and there is a recoil function. If you close it, it closes. The moment you release it, then it comes back to its original position. And both the limbs are joined at the top near your holding point. It may be tooth or it may be plain. You will be also asked that why there are serration on the outside of the instrument, because they are to support or have a better grip. That's the simple answer. There are no locking or ratchets, and thumb pressure is required because they have to be closed by thumb pressure itself. How do you sterilize them? It's a steel instrument, essentially autoclaving. So these are some of the samples you will be there. Here the Edson, which is again, this is a plane and this is tooth. This is for the finer work or the superficial work for the particularly plastic surgical purpose. And also you have then the vascular or the DeBakey purpose, DeBakey forceps, which will be used for holding the vessel or any serosa or any fine edge or delicate edge. Then you have dissecting forceps, which may be either again tooth or non-tooth for holding the any fascia or developing the plane. So again, this is maybe of different sizes, depends on the depth of the surgery. And then you'll also have, just to have a look at this jaw, this is the Russian jaw. This is holding for some, say for example, lymph node while dissecting the pelvic lymphadenectomy or for that matter, any other long or any other lymphadenectomy wherever you are doing, you can use that because it has a cup kind of tip, and also there is serration around the cup. Let's come to the scissors. What is the function? Essentially to cut any tissue or surgical material. It may be either bandage also, it may be suture also, but most of the time there are two functions. One is the cutting the different kind of tissue. So depending on that, again, you will be having the description of the seizure. You can have pot seizure, which is used for vascular surgery because they are angled and they are having advantage of approaching in a particular angle. Commonly, you will have Mergenbaum. I'll be showing the picture as well. What is the typical characteristic? Because it may be curved or straight, and it may have a delicate or strong jaws or the shaft. So generally, they are fingered looped instruments with long shaft, and they are usually nowadays with the box joints because there is advantage of stability in that. And since it's a seizure, there is no need for any lock or ratchets because you are not going to lock it. You are just going to cut it and release it. Again, the sterilization is through autoclaving. Like I said, now have a look at the jaws or the tips here. Here you can see the jaw is curved, and this curvature can have a different variation. It can have 90-degree also, it can have 45-degree, it can have 75-degree. This is the designed for approaching a particular vessel so that you are not having any ergonomical difficulty. Similarly, Mayo seizure can have either straight tip or curved jaw, also Medgenbaum, because this is something used in every surgery and you should be knowing that how to describe this instrument. Then comes the hemostat. Like I said earlier, if you are having a hemostat, the primary function is to catch and ligate a vessel. It is also used for dissection of the planes, particularly in superficial surgery, or dissection around a vessel, or dissection around lymph nodes also. So because it essentially helps you in developing a tissue plane, so it helps in dissection. Typical characteristic, again, this is a finger loop instrument with box joint, two shafts, and pointing ends of the jaws. Now, it has again ratchet because many times you have to lock and make it stable so that you can take a ligature around that. And there are no teeth on the jaw, but there are serration. Why there are serration? To make the grip stable on the tissue. Again, it may be straight or it may be curved. So the primary function is to go for ligation or control of the vessel, and also it is used for surgical plane development. Again, the autoclaving is the way to. So again, depending on the size, depending on the tip, depending on the curvature, you can have multiple variation. If you know the difference between mixture and Lahey, because one of the favorite points of the examiners that how do they differentiate, how do you identify that? So just be careful about that. Again, the Kellys, what is the use of that? How do you identify a Kelly? That you will have to describe about that. There are certain hemostats which are named after particular inventor or so. If you know that, very good. Otherwise, category of the broad category of the instrument should be good enough. These are some of the instrument. Again, this is a tooth jaw, and this again ratcheted ring instrument with the box joint cocker cocker forceps. There is a typical variation or the opening and closing pattern you must be aware about. When you essentially approach the rings together, you will also have the jaws or the tips coming together. There are certain instruments where if you try to approach the rings together, they will move away. That is simply because their box is designed in such a way that they are crossing versus non-crossing. If the instrument shaft is crossing, then it will be essentially tips will be approaching when the rings are approaching. When the shafts are not crossing each other, the tip will be opened up whenever the ring is crossing. That's the basic mechanics of the design. Now, tissue holding forceps. This is again very common. The function is that to hold a delicate tissue edge, or it can also be to wall of the cavity or the fascia. Most commonly either in superficial surgery during dissection, say for example neck dissection also, and also in deeper surgery like cavity surgery, abdominal cavity, gastrectomy, intestinal section, anastomosis also. So if you are going to do anastomosis, you will be holding the serosa, or for that matter, the bowel wall with the tissue holding forceps. And you should not be saying when you are having a tooth instrument in your hand that I will be holding the bowel wall with that. No, don't do that. The characteristic again, just like tissue holding forceps, again it will be a ring for loop or so, fingers or so. And again, there are elastic shafts with box joints, jaws, which oppose only at the tip with fenestration, and there is a space at the tip. Why there is space at the tip? Because you just want to use the tip for that purpose rather than entire surface of the jaw. And usually that is with the ratchet. Tissue holding forceps, when you say, essentially keep in mind that you will be picking up either Ellis or Babcock, not exactly the pincer grasp forceps, that is the DeBakey, or for that matter, any other, the pincer grasp simple forceps, which is for basic suturing of the tissue. Here, essentially, the idea is retraction, holding and retraction. So that's what I was talking about. Ellis, which is again a kind of a traumatic, it can be used to hold fascia and retract it. But when it comes to delicate handling, say for example, if you have to grab the ureter, or then that's the space which is helping you without traumatizing that, and you can also hold the any other bowel also with that. Now there are then handheld retractors. This was about the essentially ringed instruments, or the something to hold the tissue. Now what is there to retract the tissue? Essentially there are some handheld retractors and there are some self-retaining retractors. So the basic idea of function is that to enlarge the operating space. Opening which you have made through the incision, if that can be enlarged or retracted to give you a better working space, larger working space, to have ease of working. For it can be used for retracting anything, can be skin, can be subcutaneous tissue, or it may be abdominal wall or even the chest wall. Again, the characteristic is that these are broad-ended instruments with broad surface, rounded handle in the end so that they can fit the curvature of the retracting surface. Also, they are not pointed so that when you retract, they are not injuring anything, because the broader the instrument, more less will be the pressure on that. It will have a narrow shaft to have the ease of handling, and also it will have multiple or blunt sharp prongs at the if you are going to retract subcutaneous fascia also. That depends what exactly you are going to retract. If you're talking about the skin retraction, you can have just the skin hooks, that is also retractor, and also you can have the mustard kind of retractor, which is self-retaining. I'll show you to that. Again, the autoclaving is the way for sterilization. Now, here, these are all not self-retaining. You can see there are two ends for that. One is having a kind of a pronged, and other is having a jaw kind of thing. Typical of journey. Again, you can have a cat's paw kind of thing, that multiple jaws curved, and that gives you a better grip for retraction. So these are used for skin, subcutaneous tissue, or maybe to some extent thin abdominal wall. Langenbach, again, you can have the length of the jaw, and the angle is at essentially 90 degree to help you retract and give the pressure on that. All of them are having the retraction angle and the traction angle essentially 90 degree to the plane of the tissue. Same for the Murphy rate retractor, which is used in cardiovascular surgery also, and commonly used journey, because this is something you will definitely have in your exam for sure. One of my favorite questions is that why these are having two different shapes in the ends. So figure it out and be ready to answer that. Handheld deep retractors. Again, these are the group of retractors which are used for abdominal surgery or cavity surgery. and their function is to retract the deeply organ, either uh, organ themselves or to enlarge a cavity by retracting the abdominal, thick abdominal wall or fatty abdominal wall. Again, the characteristic is that round handle instrument, curved flexible shaft, retraction is blunt, and surface is again wide to make it atraumatic. These are some of the examples. Deaver you will have. Also, the larger version of Journey or Langenbach, which is essentially Morris retractor, again that can have the variation because of the length and width of the jaw. Then you have Harrington, which is used for retraction of any abdominal organ or essentially pelvic cavity. For example, if you are going to retract liver, if you are going to retract uterus, if you are going to retract bladder, anything can be used for that. Again, Richardson retractor, which is used for abdominal wall retraction, because now you can see that there is a sturdy handle and broad jaw which fits in the abdominal wall contour. There are self-retaining variation also, because most of the time, because what is the advantage of self-retaining? Because essentially it relieves one person of doing the retraction job. You just fix it in one position, it remains like that, and less number of surgeons can actually accomplish the surgery with the same ease. So, sorry, yeah. Where it is used, again, it can be used for either superficial wounds or abdominal wall retraction. And so self-retaining, it can have the lateral pressure against the wound wall, and retracting ends may be pronged or blunt. Because it's a self-retaining, so there has to be some sort of lock. And lock is used through the ratchets that you fix with a ratchet and it remains there. Where is it is used? Again, because most of the time, either in orthopedic surgery, thyroid surgery, or lymph nodal biopsy, because one person is doing, and then you can open the cavity using the self-retaining. So these are the example of the superficial retraction. All of you must be familiar with the Jones retractor. These are the two prongs to hold the two edges of the incised fascia, and you can open that to enlarge the cavity. So similarly here, like I said, that this is the instrument where the shaft is not crossing each other. So the moment you close the rings, the jaws will be open in opposite direction. Just think in terms of the scissors or the hemostat, where you close the rings, the tip also will close. But here the design is such that when you close the rings, it will open up. That's the advantage of design, and that is being used for retraction of the plane with the help of a lock, because that's a ratchet. You fix it there, it will not retract. You can also have deep retractors, like for the abdominal surgery and or the pelvic surgery, particularly in big fatty patient. It's not possible to keep retracting uh, from different angles, because then you will need at least 3 or 4 people just for retraction. So to avoid that, multiple jaws can be fixed in a mounted system, and that can be used for retraction. So the characteristic is that there are two transverse bars mounted on the table, and which may also have the side arms, and it gives you a broad length of the bars to fix the multiple retracting jaws or the instrument. You can keep it hooking and fix it in a particular angle at particular retraction force also, so that it remains there and you keep working inside the cavity. You'll have the table mounted system and also without table mounted system. This is not a table mounted system. This is a table mounted system. So this bar will be fixed with the table, and then the other side bars will be on the surface of the surgical cavity. You attach the retracting same jaws at particular angle with particular force, and it remains there. Here again, this is a self-retaining, but this is not mounted on the table. You will have the three-way retraction, two ways through the jaw, side arms. Or third will be also given to give the to open the cavity, which is in the bulbar. Chest wall retractor, finisher to chest wall retractor. There is a serrated jaw and lock and key. So if you start rotating it in a particular direction, it will open up, and if you want to release that, just reverse the direction. Again, it's used for a forceful retraction, like rigid wall of the chest, chest wall cavity. Then comes the needle holder. The idea of the needle holder is to essentially help you or hold the needle in the suturing. That is the primary use of the instrument, and that's the reason why it has been designed as ringed finger instrument. There are two ways to holding them. You'll be asked about. One is the fingering technique, another is the palming technique, or then maybe also a half technique. So it has, depending on the use, can have short shaft, it can have long shaft. Generally, they are box joints near the tip because that gives you a stability of the holding so that needle doesn't slide the grip of the instrument. So various kind of needle holders you can have depending on the use. So something which is rider, this will be used for holding very fine vascular needle like 5O or 6O kind of proline, also generally monofilament. See the clearly the tip is so different that up till here the instrument looks same, but here the tip of the jaw is totally different. This is a fine tip because this is meant for holding a very fine needle. Here, broad needle or the larger side needle can be held. So you need a wider and sturdy jaw. This is a typical Mayo Hagar. This is used for suturing either for skin fascia or also for bowel anastomosis. Anything can be used. Similarly, for vascular, you can have another pincer grasp technique which may be locked or without any lock. That is the Castroviejo, which is commonly used in cardiothoracic surgery, again used for 5O, 6O or 7O kind of sutures, because tip is fine and it gives you a stability of the hand without holding near the rings. You can hold in your entire palm or just like a pen holding mechanism that gives the stability. Then comes some of the vascular clamps for the hemostasis, again out vascular surgery to control the blood flow during anastomosis of the vessel. So it can be also used to control the bleeding or control the pedicle of a particular organ. Say for example, renal pedicle or IVC clamp, or also any sort of pedicled like pulmonary artery or so, you can use that. The shape of these jaws or the instrument itself gives you advantage because they are having a long S-shaped kind of shaft, and there are two bends at serrated jaw. Reason being is that both of the tips can be seen coming towards your side, so that it's not end-on instrument. It gives you idea that where exactly the instrument is applied, and part of the tissue which is above the jaw can be used for repair purpose. Remaining can be left behind with there are two sides of the control, and both the curvature itself gives the advantage that if you have to hold the IVC only partly, you can do that. You can also use for holding the pedicle so that it can be controlled when by any chance there is some injury, or for that matter you want to repair or ligate it. Similarly, bulldog clamp, because again it's a kind of self-retaining clamp. Just apply that, leave it there, and then it will stop the blood flow for the vascular anastomosis. Now I'll come switch from the open category to the laparoscopic instrument. And again, the important thing is that you should be knowing the parts of the instrument. You'll be also asked that how to dismantle it and reassemble it. If you know the parts, if you know the assembly correctly, then you should be able to show it. There is also a point of connection of diathermy in the laparoscopic instrument. Where it is connected, how it is connected, you should be familiar about that. Just to give you example, there are three parts of lap instrument. One is the sheath, other is the actual steel part of the shaft and the jaw, which will be going inside the sheath, and then there is a handle, how to assemble and lock the handle. Then also you have a knob here or the hook here to connect the diathermy. That is a common pattern for it. Essentially, the tip remains most important thing, and depending on the tip, the usage will be also defined. I'm not going to different individual laparoscopy instrument, but then the same pattern of description applies to them also. The ergonomics of the handle, you should be knowing clearly that why this finger support has been made, why this curvature has been made, because just to give the stability and ease of the handling. You can see here just like a bottle handling, because it's supposed to hold like a palm grip technique. Veress needle, what is the use of that for development of pneumoperitoneum? Why it is shaped like that? You should be again knowing where the inflow is there and how do you check a proper position of Veress needle. What is the use of a spring kind of thing at the tip to help it prevent any trauma during the sudden entry process? What is the angle of entry for different surgeries? You should be very clear about that. And typical angle is 45° after lifting the abdominal wall. Similarly, for trocar and cannula, the parts as well as the techniques, how to hold them, how to insert them, again, you should be familiar about. These are usually kept and they can be asked for you. How do you check the position of Veress? Again, the air insufflation, or for that matter saline insufflation technique, you should be knowing about, because there is a red ball inside which floats when you put a saline. That gives you idea that where exactly the Veress needle is placed. Then comes the stapling devices. Basic stapling devices will be kept certainly, like linear cutter or those which are used for bowel anastomosis or thoracic surgery. How the anastomosis is different from the manual anastomosis, that's one of the favorite question, because healing after stapling is essentially through secondary intention. That's the basic difference between a manual anastomosis and stapled anastomosis. Which are the organs where the favorable stapling is used, or the particular kind of stapler will be used? Also, there are some organs which are not suitable for stapling, not favorable for application of stapler. Again, for example, if you are asked that why don't you just staple the cervical stump or the vaginal stump? So there are reasons for that, and you should be clear about that. Again, what is the way to correctly use that? What are the steps of using a stapler? You should be knowing about, particularly precautions. Why you should wait after you have locked the jaw. There's a reason behind that. Logic is that it displaces the fluid, then it stabilizes the tissue, and the tissue thickness is optimal after waiting for 10 or 15 seconds. Then we fire that so that the edema fluid is at least displaced. So these are some of the reasons why you should be familiar about and you will be asked about. Basic types of stapling device, you will have either cutting devices, or most commonly staple and cutting, which is the dual device. You can have, again, I'll go to the pictures themselves. This is the linear cutter. You will have to show the steps of application. Also, circular stapler, which can have the power variation, or you can also have non-powered variation or manual variation. You can also have the radial variation, which is used for rectal stump. Similarly, the contour stapler, again, the shape is made to, so makes it fit in the narrow cavity of the pelvis or deep pelvis for LAR or low anterior section. Similarly, the shaft gun or the laparoscopic or the thoracoscopic stapler will have the control, which is in form of lever technique. There will be also angular variation, which is helping in the adjustment or the application of the stapler at a particular angle. The point of description remains the same. What is the purpose? There are titanium clips of different heights. What is the number of rows? Also, the height of staples, that depends on the color coding. What kind of color is there, that will give the thickness and appropriateness for the kind of tissue where it is going to be. White will be used for vascular, green will be used for maybe either bronchus, or also for the thick bowel tissue. Also, the shape of the closure. There are some advantages and disadvantages of the staplers or the drawbacks. I'm not going to detail again, but then the both the aspects you should be very clear about. Some drawbacks are there like cost and the if you are asked about leak rate after anastomosis, they are going to be similar. There is no difference. Essentially, the technique of the surgery matters rather than the instrument per se. Now, briefly, I will touch upon the energy devices also. There are two kinds of, and these are going to be certainly kept in your exam. Both, first of all, the basic diathermy, the monopolar and bipolar. So what is the difference between monopolar and bipolar? Simply is example of question I am asking, but then you should be ready with the answer because monopolar uses higher voltage energy, bipolar uses low voltage energy. Again, there are two variations in monopolar itself, cutting and coagulation. You will be asked that what is the basic difference or physiological difference between a cutting and coagulation current, because cutting is through continuous sine wave and coagulation is through pulsed sine wave. So that's the basic difference. I'm just giving you an example that what you can be asked about that, but be thorough and familiar with the diathermy, so you will be certainly asked about that. Similarly, for sealers, basic vessel sealing and cutting devices, there are three of them which are commonly used. One is the ultrasonic device like harmonic scalpel, other is bipolar device like LigaSure, and third is the combination of these two, that is Thunderbit. Like I said, monopolar cautery, what is the difference between the in the current flow in the cutting versus coagulation, and what is the basic functioning or the application of cautery or the diathermy, because monopolar will require grounding whereas bipolar does not require that. Then that's the reason what is the different uses for them. And because of that, because the coaptation, the lateral thermal damage is much less in the bipolar technique, bipolar forceps, and that is the reason why it is used in thyroid surgery or near the critical nerves or so. Bipolar cautery, different shapes you should be familiar about. The jaws, bayonet versus straight jaw, because this will be generally kept in the exam and one of the favorites from the examiner. Harmonic scalpel, again, very commonly placed. Ultrasonic energy is converted into mechanical energy because of piezoelectric effect. It has got both sealing as well as cutting function, and this is suitable for particular size of the vessel. Generally, it is claimed up to 5 mm. And it has got one active jaw, one passive jaw. Only one jaw will be vibrating, other will be supporting. It helps also in the dissection. Different shapes are there, different uses are there, should be knowing about. And then comes the bipolar smart devices like Assure, which is based on the application of precise amount of bipolar energy and compression. So these two are combined to make it intelligent, to make it think that where to stop. And then it seals through the coagulation of the tissue protein, elastin. It has got, again, to minimize the lateral damage compared to monopolar cautery. That's what it is used. It also helps if you have the Maryland tip, it will help in dissection. Blunt jaws generally will not help for dissection purpose. Thunderbit, like I said, it's a combination of these two modes of energy. It is a very versatile instrument. There are again functions for both sealing and seal and cut. There are two ways to using that. The jaw is such that it can be used for dissection purpose. The many uses where this instrument can be used is for laparoscopic, either abdominal surgery or thoracic surgery, both like pulmonary surgery, lung resection, or any sort of abdominal laparoscopic surgery can be used for that. Now, I'll stop here and just bring you to the broad discussion part again, just to give you a few tips, because there is no end to the list of the instrument, but what applies is the basic pattern of the description. So many a times you will be asked that why don't you choose yourself and be ready for that. So when you are prepared to choose an instrument, you search for that, pick up an instrument, calm down, and then start a description. So be ready with a list of instruments which you are going to choose. It's not that only one, but at least 4 or 5 of them, and at least one from each category, so that whenever you are given an option to choose, you are ready and confidently you are doing that. Start the headings as you have been told, but it requires a rehearsal, it requires a practice, so that you are not fumbling when you have started the description and you have started and finished in one flow. Again, it should not be just like a mugging kind of thing, or it's like that you have just vomiting it out. No, don't do that. This is an interactive exam. This is not something that you are recording your answer or so. So you have to practice it in a coherent way and speak while you are looking into the eyes of the examiner and also on the face of the examiner, rather than just staring down the instrument and looking at somewhere else. Don't do that. Stop immediately if you are asked any question when you are describing that, because it should not be sounding that you have mugged it up and now you are trying to blurt it out. No, don't do that. You have to remember that every instrument is designed for a different purpose. One particular purpose which is specific with that instrument is to be very clear about, and there is no substitute for good knowledge that everybody knows. Many times you will be finding something unexpected, particularly when examiner chooses for one instrument for you. Then you can have some trouble in that. Be ready for that. It's not that it will be unknown completely, but what if you are not sure about? Then also be prepared for that. If you are not seeing the instrument earlier in your life or not knowing the exact name, just be polite and accept it. I am not sure about, but if you can describe it, describe in a generic fashion. And to me, it looks like this and this. You may be right or wrong, but then accept it. If you are not comfortable, examiners are gracious and generous enough to allow you to pick another instrument. Take the advantage of that and pick up another one. But then it's a something, one human factor like honesty, which will be assessed there without being told that what we are assessing you. And please don't try to fool the examiners just by sounding very, very smart and confident. No. If you don't know something, accept it. That's all. I think I'll stop here. Thank you very much for your patient listening. Now I'll just try to check where the question answer box or the chat box. I can stop sharing, correct, sir?
Yes, sir.
Okay. All right. So there are some chat boxes. Let me go that there. Okay. One question says that what is the concept behind transverse versus longitudinal serration in vascular clamp versus bowel clamp? So essentially, you will be seeing that the longer serration are used in the long shaft or the long jaw clamps. The transverse one are used for holding something very, very sturdy kind of tissue. Because if you see the surface area in the transverse versus longitudinal, longitudinal is meant for gentler one like bowel holding or so. Transverse is made for sturdy or very rigid kind of tissue, like which is much, even if like it's more traumatic, it is acceptable. The transverse one is not utilized for holding delicate tissue like vessel or bowel, where the serrations are longitudinal. That gives a gentler grip, also relatively much less a traumatic, much less kind of traumatic grip, so that it creates minimum damage. If you are going to hold something which is to be just ligated, there that it can be used for transverse serration like hemostat, or for that matter Kelly's, or any other instrument that is used only for a sturdy and rigid grip. That's the basic difference. Okay, I'll also go to Q&A session. Oh, it's the same. No. We have some time, so if you have any questions or queries, uh, you can just type them in the boxes. I'll try my best to answer that.